2, 1, your life.
All right, great. Thank you everybody for joining us for Thursday Thoughts here at Pure Plastic Surgery. I'm Dr. Wegerif. Today we're going to be talking about a really important subject that we get a lot of questions on and that the plastic surgery community has gotten a lot of scrutiny on over recent years. And this is lipo360 BBLs or gluteal fat grafting and the dangers that are associated with that and what we do to mitigate those risks. So this is something that really came under fire, a few years ago when there was an unacceptable amount of patient deaths related to this procedure, and it was really due to the technique that people were using and how the actual fat grafting was being done that was leading to this increased risk of a feared complication, which is fat embolism, which we'll talk about in more detail. Fat embolism is whenever fat gets into our bloodstream, goes into our heart or lungs and causes a blood clot that's really hard for us to treat medically. So what are the things that we have to think about when we're doing this procedure? So first of all, what is a BBL or gluteal fat grafting? That's whenever we take fat from liposuction from a different part of your body, from the belly, from the flanks, from the back, and we transfer it to the buttock to give you that nice shape that you're looking for and a little bit of a lift. We do that with fat grafting. We're actually injecting that fat back into the buttock. And the thing we have to think about doing is where we're injecting that fat to decrease the risk of this complication. And to do that, we need to make sure that we're injecting fat into fat and staying above the muscle. So first we have a layer of skin, then we have a layer of superficial fat, and then a layer of deeper fat, and then we have our muscles. Our whole goal is to inject into that deeper fat. And so by doing that, we decrease the risk of getting any fat into the superior and inferior gluteal veins, which is the area that can really cause a problem if fat gets injected into those veins. So we stay above the muscle. How do we do that? So we do that with a few things. One is just good understanding of the anatomy, proper patient positioning so that whenever we're injecting using our cannulas, we're going in a manner that we can stay in a superficial plane. Understanding what it feels like to inject fat into fat, there's a different feel, and just having experience with the procedure, being trained by professionals who have done this many times, and then having experience in doing it many times. But what is really the most definitive way to understand if we're doing this correctly and staying in the right plane is by using ultrasound imaging. So I'll go over a little graphic here real quick and show you exactly what we're able to do with that. This may be a little small to see, but this is just showing the anatomy of the buttock and the gluteal veins. So here's the areas, the superior and inferior gluteal veins. So the area without the cutout, this is the most dangerous area that we really need to be cautious of when we're injecting fat. So this is a depiction of staying superficial, and the green area is the fat. And that's showing a good trajectory of the cannula staying in that fat. Below is showing the red zone, which is the muscle, and a cannula actually going into the muscle. So how we're able to really definitively stay in the fat and know we're doing that is by using ultrasound guidance. This is kind of hard to see if you're not used to looking at ultrasounds, but to someone who's used to using them all the time, it's easy to see. So first we have the superficial layer, which is the skin, then we have the superficial fat. This little layer of fascia is something called scarpous fascia, and then there's the deep fat. So this is really where we want to be injecting the fat. And below that, this more gray area, densely packed area, is the muscle. We're able to see that on the ultrasound, and we're able to put our cannula directly where we want it and inject under direct visualization. So this really takes a lot of the guesswork out of this procedure and being able to do it correctly. There's also a few other things that we do. We always use large blunt cannulas. These have less of a risk of going into those blood vessels. And then again, like I said, it's the proper patient positioning and proper technique. So we take this very seriously here at Pure Plastic Surgery. All three of us use ultrasound guidance for our BBLs. And that's really becoming the standard of care in Florida. A lot of people were late adopters of this. We were earlier adopters of this here at Pure Plastic Surgery. And it's now actually being state mandated in Florida that you do use ultrasound to do this. So, you know, we want a surgeon who's experienced in using that to be able to give you the best results in the safest manner. Do we have any questions about this?
We have a few comments. The first one is, I'm so excited to meet you, doctor. My surgery will be next month.
Awesome, can't wait to meet you.
Okay, and let's say, how weeks should I wait to have a BBL after a tummy tuck?
After a tummy tuck, I like to wait a minimum of 6 months after that, because whenever we do surgery, we elevate the tissue from your tummy tuck. You're gonna have some scar tissue that develops in the abdomen, and over time that scar tissue softens up. So if we wait at least 6 months, you're gonna get a better result with the liposuction, where we're harvesting that fat. And then you're just gonna have a better, smoother outcome. So at least 6 months, even waiting up to a year is a reasonable thing to do after a tummy tuck to get your BBL.
This patient has 10 years with her implants. She asked if they should be replaced.
So that's always typically what the industry recommendation is for implants, or they guarantee the length of implants for 10 years. And it depends on if you have saline or silicone implants. If you have saline implants, you'll know if you have a rupture because you'll get a flat tire, one breast will go down. But for silicone implants, we really need to do imaging, which can today be either an MRI or an ultrasound to look at the integrity of the implants. If they're still intact without any sign of rupture and you don't have any capsular contracture or any other problem, you can wait a few more years, but you should start thinking about it. If there is evidence of a rupture, you should definitely get them replaced.
Okay, this is for Emmanuel. She asked how to make an appointment and how are the payments.
So go to pureplasticsurgery.com, and right in the little corner you'll see an area to do a virtual consultation, and then also to schedule an appointment at that time.
Okay, there's more people joining the live.
Welcome.
Welcome. Okay, we're now on TikTok, and the question at your TikTok, Dr. Wegerif, is... Wait 1 second here. Okay, if you use drains for the breast implant or breast augmentation?
No, never use drains for breast augmentation.
Okay, we're still on TikTok. If you're available in Miami, Florida, and how about the drainless tummy tuck? How many weeks I should wait until go back to work?
To go back to work after a drainless tummy tuck, I always tell people to plan on 2 weeks. This is depending on what your job is. If you have a desk job, you can go back to work when you feel up to it. Most people, it's around 2 weeks, but if you do a job that requires heavy manual labor, you need to wait at least 8 weeks to go back to full duty.
Okay, this is an out-of-town patient, and she asked when she can fly back after a BBL.
After a BBL, you need to stay a minimum of 7 days after your surgery before you can fly back. And that's all to decrease the risk of having a blood clot in your legs. All right, everybody, thank you for tuning in. I really appreciate it. Let me know if you have any questions. Shoot me a DM or go to pureplasticsurgery.com to schedule an appointment. Have a great day.